everyone, good morning. I'm Aishwarya Sandeep and I'll be your host for today's live session with Dr. Hema Sathish. So I hope all our viewers are here right now and you're really looking forward for some amazing giveaway that we are planning to conduct today during this live session. So please stay with us while we add our guest. Hi Koshala, how are you? And hello to all the viewers. We really hope that you are also quite active during our live session so that we can we've got some awesome giveaway for you. So there are going to be 6 pairs of beautiful earrings and a few hydrating lotion, and we've also got a surprise bumper prize which is going to be a muslin swaddle cloth. So yeah, we Indians know how important it is to swaddle our babies so that they go back to sleep, and it's also quite simple for us to even lift the baby once it has been swaddled. So I'm just waiting for a guest to join. Hi, I'm doing good. How about you? So I'm just waiting for a guest to join. In the meanwhile, I hope all you moms have kept your experiences and your questions ready so that we can have your experiences in our live session and that we can help you to win some amazing prizes. So just give me a minute till the time we hold for our guests today. So hi to everyone, all those who have sent in your highs and hearts and waves. So hello to everyone. So in the meanwhile, till Dr. Hema Sathish joins us, can someone tell me what is it that your plans are for the weekend? What are you planning to do for the weekend? Hi Chitra, hi Neha, I'm doing good. Girls with Trends, hi. King Funds, okay, yeah, I have called you. Sumegha, hi. Lakya, hi. Hi Raksha, I'm doing good. Oh, movie plan, that's amazing. So which movie are you planning to watch? Girl with the Trend says it's so cold here. Oh, that's awesome because I'm from Mumbai and Mumbai is already moving towards summer. Priyadarshini, hi. You're saying movie time in the weekend. Wow, that's awesome. Everybody seems to be having a movie plan. So which movie are you planning to watch? Oh, just chilling at home and Netflix. That's awesome. That's something that I do because I've grown old these days. Chilling at home and Netflix. Okay. So any new Korean dramas on Netflix? Pathan. Oh, yeah. Oh, nice, Koshala. You're going out with family. King Fun says Pathan. I love Deepika Padukone, by the way. I'm a huge fan of hers, but I have 2 small kids, so it's very difficult for me to, sit and take them out for the movie. They are very impatient, and I'm sure all the moms here can relate to it. So keep posting in your plans. Till the time we have our guest online. So how do you all handle your kids when you take them out to movies? Like mine, my younger one is 4 years old, and the maximum she can sit in one place is, I think 10 minutes. 10 minutes is an achievement for me. If she sits in one place, I don't know how their school teachers handle them, but at least for me, it's like that. Oh, Wakanda Forever is on Disney Hotstar. Yes, I've read good reviews about that movie. Hi, Pavani. Pavani is waving. What are my plans? Okay, as of now, I have this live session. Then evening, I've got another Zoom call. I'm planning to start recording a lot of other content, and in the evening, yes, I'm planning to go out. So metro has recently started near my house, and my kids are insisting that they want to ride in metro. So yeah, we'll be going down for a trip to the metro. Life in a metro while staying in a metro. Yeah, when will I get my previous giveaway? Hi, Sumega, someone from our team will get in touch with you for the same. Oh, thank you so much. You'll try to give them some healthy snacks. Yeah, we do try to do that. And makhana is, that is your lotus seed, is something that the kids love these days. So you have a very good familiar neighbor. Wow, I think having a familiar neighborhood also helps a lot. I don't know, I'm still scared and skeptical about leaving my kids with my neighbors. Okay, so hi to all the new viewers who have joined us right now, and those who have previously joined us also, please don't leave, because we can start with our giveaways at any given point of time. So I guess our guest is here right now. Before that, we have already got a few coupon codes which are a special gift for you for the House of Zelena family. So I'll be just posting a coupon code right now and you can use it. Hello?
Hi.
Hi, good morning, ma'am. How are you?
Hey, fine, Aishwarya. How are you doing?
I'm doing great, ma'am. Thank you so much. So I was just telling our audience about this amazing coupon code that
I'm not able to hear you now.
so we'll just officially start with
Get it on my phone. Right on the number.
उनका कुछ इशू चल रहा है
who is
Yeah.
a renowned dermatologist. Can you see me? Is there any issue?
Yeah. As of now, I can't see you. Yeah.
Okay, yeah. So as of now, so we have with us today Dr. Hema Sathish, who is a renowned dermatologist and the founder and managing director of Devadoss Hospitals. and Sanche Cosmetic Center with clinics in Madurai and Mumbai. Okay, can you see me now?
Yeah, I can see you very well.
Okay. Sure, because it seems in between my screen was not visible.
Yeah, some technical issues were there. I think it's sorted now.
Yeah. So introducing our guest, Dr. Hema is a renowned doctor. She's well known for laser and dermatosurgery and cosmetic dermatology procedures. She has done her dermatology training at the University of Wales, Cardiff, and also attended several training programs for the same in UK, Israel, and India. Uh, Ma'am created Cureka with the vision to provide high quality, 100% authentic healthcare products to the people of India, to the Indian people at very affordable price. So Cureka.com is like your go-to healthcare store for all the nutritional wellness, personal care, skin care, uh, hair care, and pain relief and elderly care. So wow, that is something that we Indians right now require. These products, they have been enlisted at Cureka.com. They have been curated and created specially by doctors, ensuring that every consumer gets the best quality product. It is more effective and it is more authentic, because we also know we also have a lot of bad products in the market. So Cureka is something that is providing you with some genuine and authentic product. So Dr. Hema has been instrumental in setting up another digital product by the name of Second Opinion, which is quick, effective, and easy access to high quality doctor consultation. So that is another thing that post-COVID a lot of Indians require right now. So patients can have access to this app through iOS and Android stores. So that's why I'm definitely going to download the same after this. So welcome, ma'am. And we are very thankful that we have you today for our session. Your expertise, I'm sure, will help a lot of women. And I personally have a lot of queries to ask you. So, yeah. So, ma'am, my first question is that quickly, if you could just tell us that what are the basic skin problems that are genuinely faced by a lot of pregnant ladies and mothers? Because a lot of times it happens that people tend to ignore these problems, to identify these problems.
Well, to begin with, when one is pregnant, there is a lot of skin changes which happens just because of physiological changes which are happening in your system. That is the hormonal changes which are basically happening. So to talk about the good part, your skin will have a very good glow and your hair won't fall for the period of time when you're pregnant. All this is also expected, but at the same time, you can expect other changes like skin might be very, very sensitive to anything. If you have any other skin problem, it can be exacerbated more, and you'll become very sensitive to everything applied. So you could develop more of eczema, more of psoriasis, and sometimes it will decrease also during your pregnancy. That can also happen. And specifically, if you have to say during pregnancy what you'll develop, then you have the skin discolorations. That is, you get melasma, or it's called pregnancy mask also, where you develop dark patches around the face only. And there are then more skin changes to talk about would be stretch marks. Stretch marks can develop any part of the body just because of your weight gain. Then if you have to talk about other parts of the body, there will be sagging of skin eventually, and then everything you suddenly put on a lot of weight, so there are a lot of things happening because of that.
Okay. So, thanks so much, ma'am. Ma'am, we had received one query. That is, what exactly is this acne near your jawline? That is one more problem we've heard from a lot of mothers that they've been facing.
Yeah, well, acne also, sometimes some people develop acne first time they might develop during their pregnancy, but sometimes they would have had it earlier in their life and then they would get it back again. Sometimes it is not acne also, especially when you're saying around the jawline or around the mouth, we call it perioral dermatitis. It could develop because of the hormonal changes, because of some kind of medications also. At times, some people use nebulizers. So, when you use that, the steroids or that time also it causes a lot of perioral dermatitis. And if you're using some topical applications and then using face scrubs can make it worse. So if you're having something like that, then you should meet a doctor. If you're not going to a doctor right now, at least use some mild cleanser. Stop scrubbing your skin. Stop irritating it. Don't use any chemicals or any creams as per your whims and fancies, especially no steroids. Because if you apply that, it can get worse. And during COVID, we saw more of this because of the mask they were using. The mask per se was rubbing against the skin and all this problem comes.
Okay, so thank you so much because we didn't know that mask could also cause acne. We generally use it to protect ourselves from the pollution. So with this,
it's called mask name. Mask.
Okay.
So,
Okay. So thank you so much. That is something new that we learned today. And along with this, we have something interesting for our viewers as well. We have already posted the special coupon code that our viewers can use at cureka.com. Those are special discount codes exclusively for the members and the family of House of Zelina. And let's come down to our first giveaway question. That is only one mama is going to win this. So it's just going to be selected randomly. So ladies and mothers and sisters, can you tell us about what are the issues that you faced during your pregnancy? You have to type it down in the chat box. I'll be continuing with our chat session with ma'am. And once I'm done with this question, I'll be announcing the winners. So you have sufficient time to put your answer. Ma'am, moving on to our next question. I'm a mother who's already undergone 2 sections, and for some told that there would be an abdominal scar that would be permanent. But luckily for me, during both my C-section, the scars are almost as good as invisible. So, what are the new technologies or what are the new threads that we could say which is available right now, and how could our mothers be aware about the same so that there are no scars?
okay, now what happens is C-section scars are given in the lower bikini line is what we call them, bikini line scars. So they are, and they use subcuticular suturing material also. So the line is a thin line. But if a person is sensitive to the material used while the suturing is done, or if they have not handled it well, or eventually had a secondary infection post surgery, then the scar has a chance to get bad. Otherwise, usually nothing happens, and this line is very much below down there and doesn't show up much at all. But in case if you are worried about your scar or you have a tendency to develop keloids, that is, or hypertrophic scars, that is your scar. Sometimes some people have this issue, if they have a small scar also, the scar doesn't stay just like that. It just thickens, it becomes bigger, and then there's a lump developed on that. In case if you have such issues, then you can handle it by using silicone gel sheets from the beginning itself. That is, once a suture is removed and then the scar has healed well, after that you can use that. Or you can use some gels also. There are many gels available with a lot of ingredients in them. You can use them. What they do is they usually have ingredients in them which disrupt the tissue from developing further. So they break down the tissue over there itself and it keeps it softer. So this would help to a certain extent.
Okay. So thank you so much, ma'am, because itching is one of the common
yeah. Itching is bound to happen, and when you have itching, ideal thing to do is use a moisturizer, or use if your scar is still a little sore, then it's advisable to use an antibacterial ointment, so that it is thicker, it's more oilier, and then it protects the skin better. And itching is bound to happen during the healing phase. So when the itching is happening, it's to understand the skin scar is healing now. So this when the skin heals, there is a itching. Most of us experience. So it's normal actually. So just to avoid the itching, you can use some lotions or just in that area to avoid the itching. And ideally, don't scratch.
Okay. So thank you so much, ma'am. That was really informative because I personally know a lot of women who are scared of C-section because of the scars, of the prominent visible scars. So we've got some interesting answers. We've got one from Raksha who says she had heavy headache, craving sensation to smell, severe backache, and much urge of urine. Trust me, I've had the same issues. So
These are all normal.
these are some of
pregnancy, as
yeah,
the trimester keeps increasing.
yeah. And then girl with the trend says she had tiredness and sluggishness, sleeplessness. Yes, I've stayed awake like 3 to 4 nights. Dryness and stretchy skin along with blemishes and pigmentation. Wow. That's a real
Well,
skin issue.
you have dry skin, so ideally you should make sure that you're taking care of your skin in such a way that it's moisturized well and you don't get very itchy, don't scratch it or you don't rub it too much, because when dry skin is, rubbed or you try to do something to it, then pigmentation does come. So pigmentation can be very much secondary to the dryness which has developed during the pregnancy because of the hormonal changes. So, the sequence of events in the end, you find that you have a dark patch and it's called post-inflammatory hyperpigmentation just because of the irritation caused to the skin. So if you can avoid it then and there itself, yes, the pigmentation wouldn't come in if it is because of the dryness. And
Okay, sure. So
somebody who said they feel a lot of tiredness. You're
yeah.
feeling a lot of tiredness, then you have to check on your diet really well. Because yes, some amount of tiredness is bound to happen, but if you're just not doing much of work, but routine work can be done. So even if you're pregnant, we don't advise them to stay at home or say sleep the whole day or don't do anything. We advise them to do all their regular activities. Yes, some extracurricular activities or something very heavy exercises or something should be avoided eventually or in the beginning also for varied reasons. It depends on individuals also. So every different person will have a different lifestyle to follow during their pregnancy. But if that is happening, probably you are having iron deficiency or your diet intake is not good enough, because your diet intake should be much, much higher than what it is usually when you are just normal, you're pregnant or something.
Okay. So I hope everybody will take care of their diet from now on. Ma'am, we have one more question from Raksha. If you could please answer that. Please tell us how to get rid of stretch marks.
Well, getting rid of stretch marks, maybe we can use some magic wand, because that's how it actually works. There's no treatment to get rid of stretch marks as such. Yes, it can be made better. What happens is the skin will stretch because there's a sudden weight gain of 10 to 15 kgs within a short span of time, and you are going to gain the weight and you can't avoid it either. And so when that time, what happens is the skin gives way, and these are actually stretch marks are scars which develops. So it's because of the disruption of the skin and the collagen inside the skin which is causing this. So you can't do much, but what you can do is you can keep your skin moisturized really well. And the topic is really huge. So you start early, keep your skin soft, keep it maintained very well. And eventually, once you have delivered, if you have had a normal delivery, then immediately start some kind of oil massage or something which would help, means get rid of at least the dark patches and reduce the inflammation in the skin, and all those things can be done. But if you have had a C-section, yes, you have to wait for 4 to 6 weeks to start with all these things. So there is no magic to it. But yes, you can try creams. But as per theory, like as per all the research papers which we have gone through, hundreds of them are there, and there is no paper which says that there is a magic cream which can work and which will not cause a stretch mark. When you use it, yes, it is a little lesser, but avoidance or without stretch marks, no.
Okay.
Probably
So that's actually
the answer, right?
yeah. We got the answer. There's just one more small follow-up. It's been asked by one of our viewers. They have asked, how soon should we start using Kumara Jaya Sim has asked, how soon should we start using stretch mark cream, and what is better, oils or cream?
Well, there are two things to it. You can start as early as you want, because usually in the first pregnancy, if you are getting pregnant first time, the skin holds quite well for quite some time actually. So you can start by third or fourth month also. If it's the second child, then of course you start from day one itself, because the skin starts sagging much faster. And creams absorption is much better than the oils, but at the same time, if you know which oil to pick, because there are oils which get absorbed faster in the skin, and there are some oils which are retained later also. So it depends. You can choose the oils, or you can have a combination of oils also. But the rule during pregnancy is never massage. You cannot massage. So you can rub in your oil gently and leave it for it to dry, but you cannot massage. But once you start massaging, there is a reason for it, because all the blood circulation should ideally go to the uterus, to the baby, not to the peripheral part of the body, which is the skin. So you shouldn't massage at all. So you can use both depending on what suits. But absolute no would be a retinoid containing cream. You cannot use retinoid containing creams to apply on your abdomen when you're pregnant, or a steroid containing cream, because many people have this habit. They go to the nearby medical shop and tell some doctor he also has this magic cream to give you which contains steroids, and then everybody applies it, and the skin is smooth and nice. Please don't do it. No steroids, no retinoids whatsoever when you're pregnant.
Okay. So thank you so much, because we were not aware about the ingredients about retinol or steroids, because generally retinol is something that we commonly use. So thank you so much, ma'am, for this information. I'm sure it will benefit a lot of new mothers. And moving down to our first giveaway, the winner for the first giveaway is Girl with the Trends. So you will receive an amazing gift from House of Zelina. So thank you so much and congratulations. Moving on to our next question, which is one more common concern of a lot of new mothers is breastfeeding. So how do you take care of your skin during breastfeeding? Does it affect the skin, or how is it?
Well, there are two ways of dividing this. One is the breast engorgement does happen, so it becomes bigger in size, and just because it's becoming bigger in size because of the ducts growing in size and all the hormones playing up, the laxity of the ligaments does happen. So you have to make sure that there is a good support within the breast per se. Apart from this, yes, coming to the nipple, there are many issues people have with the nipples also, because the nipple can get really sore, it can crack up, it can, because of the hormone, because of the stretching of the skin, because of the suckling of the baby, all kinds of things play out. So if that has happened, then you might have to use some medications to avoid the fissures or the cracks in the nipple. So there are two ways of managing it. So if you could be more precise and ask me, or what you want me to tell you exactly, I'll be able.
Uh, Hello? Hello?
Problem?
Yeah, sure. Precisely, we are looking for probably sagging of skin, sagging of breast post breastfeeding.
Then the ideal thing is make sure you're wearing a support bra, and you don't lose weight suddenly. Breastfeed your baby well and gradually lose the weight. Then there is a little bit of a solace that it might not sag as much as it would have sagged otherwise. But whatever it takes, it will sag to a certain extent. And support bras from the maybe third or fourth month of pregnancy is going to help much better. And when you're nursing also, holding it in a proper position, holding the baby in a proper position, and using nursing bras, which gives full support, all these things will help you in the long run. And massaging is not very much advised at that given point of time. But yes, avoid clogging of the ducts by not feeding. If the baby doesn't suckle well, or your baby is not well, in advance itself, what you can do is you can have express breast milk. That is, you can use some breast pump or something to express the breast milk, and keep it in some bottle safe, so that the baby can be fed later, or just discard it if it's kept for a long time. Because if you keep it for a long time, then the breast gets engorged, and then you can develop some abscess eventually, because of so many sequence of events happening because of that. So if you can avoid all that, yeah, unnecessary too much sagging of the breast can be avoided.
Okay. So thank you so much, ma'am. Ma'am, there's one more query, that are these changes permanent postpartum, stretch marks, or sagging of skin, or what are the things, what are the precautions that a new mother can take to avoid the permanent skin changes that happen during pregnancy?
Usually, most of the skin changes are very temporary, so they would go away. Like if your rashes, or some people get allergies, some people get some boils here, there, this, that. There is a long list of problems, but most of them resolve after delivery of the child. But what happens with stretch marks is, yes, they do get better. I mean, they will not look as bad as it was there during the pregnancy, or they don't look very sore or red, or many people have it in different colors, dark brown, red in color, very pink, and it might be painful at times. All that will go away. But yes, the skin differentiation of this stretched skin being a little lighter in color is going to stay. And the sagging, to a certain extent, if you haven't taken care of, or if you have put on a lot of weight and then you lose a lot of weight, then all these changes are going to be quite a bit. So to avoid this, yes, one suggestion would be gain the weight judiciously. That is, be cautious about what you're eating during your pregnancy, and lose the weight also cautiously. So when you do that, the changes are more, sequenced, we can say, and we can control them better. So ideally, if you're very particular about all these things, stick on with a dietitian who's going to tell you how to follow a diet properly, how to gain your weight in each trimester, and then how to lose it gradually once you deliver the baby also. Because you cannot go on crash diet. You cannot go just not eating properly. You have to be healthy. At the same time, you have to have a healthy baby also. And at the same time, you have to take care of yourself also. So this would need expertise. So maybe stick on to a dietitian. It will help better.
Thank you so much, ma'am. Ma'am, I've seen a lot of queries from our audience also. So we'll be just taking a couple of queries from our audience. In the meanwhile, for the audience, we are here with our second giveaway. So you just have to answer one simple question. That is, did you face any issues while breastfeeding? If you did, do mention it into the comment section. And just like previous session, one lucky winner will be getting a wonderful giveaway from House of Zelina. Ma'am, one question that we have received is with respect to blemishes that appear during pregnancy and how to get rid of them.
Well, blemishes can be categorized into a few categories. If it is melasma, then it's going to stay for a long time, and the hormones have to get back to normal, and you will need some treatments also additional, and they will go away. If the blemishes are because of some other skin rashes which have come up, yeah, once the inflammation settles and once you take some treatment, it will settle. So usually we look at skin changes which have started during pregnancy to go away by within 4 to 6 months post delivery. But as a dermatologist, even if you come to me immediately after your delivery and ask me for several things, we are going to treat you very cautiously, because if you're a nursing mom, then we have to be very particular about the medications which we are going to give you and how we are going to handle you, because your skin will be very sensitive at that time also, and your hormones have just gone up and then they'll be coming down also fast. So we have to hold everything together and then treat you. So that becomes quite a challenge. But then yes, individually all these treatments are tailor-made and planned, and it can be treated, and it should be fine. Few months after pregnancy, you should be back to normal. Everybody bounces back to normal.
Okay. So thank you so much, ma'am. I hope that input was useful. We have just one more question from the audience. That is Kumar Ajay saying, my wife's elbows and knees got darker during pregnancy. Is this something we can take care of before it happens?
Yeah. Yeah, you can. It's a very simple thing. You just moisturize it really well. If not anything, at least use petroleum jelly regularly, morning and night. It should be fine. If you can find some, plant-based body balms, that would work better. And suggestively, don't use any lightening ingredients in them as during your pregnancy or post-pregnancy immediately. Eventually, you can try. Otherwise, you can just use this moisturizer and it will help really well. But it needs a thick moisturizer, not the general moisturizing which is available in the market.
Okay. So thank you so much. I hope now after ma'am's live session, everybody will look at the ingredients before purchasing any products and just using any random over-the-counter products. Ma'am, just one last question from the audience. That is, how to maintain hair care during pregnancy?
Well, during pregnancy is the best time actually. You won't lose hair because all your hair will be the emergent phase. That is the a stage where it's going to grow really well. So it's growing and it's glowing. Everything is fine. But once the hormones comes down, then it's like about a period of between 16 to 20 weeks, the hair starts dropping like hell. It is that time you have to hold for. You have to make sure your diet is very good. You have to take your multivitamins really well, and you should take good care of your hair also, and make sure your scalp is clean. Your diet is regular. In a sense, don't eat just once and then you've eaten a lot for the day, so you are going to leave it off for the rest of the day. No, have it in a consistent pattern. So make sure your proteins are taken well, your minerals are all fine. If there is something, then you should take some multivitamins also along with it, and your calciums are taken well care of. Then maintaining a good lifestyle also helps. That is, if you exercise regularly and follow a good pattern of life, then your hair does grow back. Usually it takes about 4 to 12 months for the hair to grow back, but it falls within 2 months actually. So everybody gets really scared when they see their hair loss, and it is bound to happen. There's no choice. So, but if you need help, you should go to a dermatologist, take the help necessary, and make sure that the hair regrows within the 12 months.
Okay, sure. So thank you so much, ma'am, for these inputs. And we have also received a few answers from our audience with respect to their experience on breastfeeding. One common answer, if I could, I'm sorry, we are running short of time, so I'm just clubbing all the answers together. So we have backache while sitting and feeding, nipple biting by kid, midnight feeding is tough during nights. Too less information about breastfeeding caused issues. Then we have Bandana who said inverted nipples, redness and soreness in nipples, then sore and cracked nipples. Nipple biting by kid, that seems to be the common answer. Bandana says she applies balm around nipple area. So for this this query, we have one winner. Just one. So the winner of our second giveaway is Raksha Ravi Kiran. So hi Raksha, do get in touch with us after this session is over. Please DM us your details and we'll be sending away your gift soon. So moving forward to our next question.
Some other question. There was somebody who said they have back pain. Back pain usually during nursing is because they don't maintain a proper posture. Ideally, you should give your back good support when you're nursing the baby. Even sore nipples, also positioning of the baby with the nipple is mandatory. If it is done correctly, the sore nipples also can be avoided. And if your nipples are cracked or you have sore nipples, if it's cracked very badly, then of course you need medical help. If it's just sore, what you can do is even the breast milk which has come out, little bit if you rub it on the nipple, that also will help healing the nipple well. So it's just a small tip I just wanted to say before you go to the next question. Please.
Yeah. Thank you so much, ma'am. That was a very useful tip because it's a very common problem faced by all mothers, but we have very limited information. Ma'am, moving on to our next question. Can new mothers safely use chemical peels, laser treatments, or other procedures to address skincare postpartum?
Well, how new we have to decide on that, because ideally no laser or no peel for 4 to 6 months, especially if you're nursing your baby, because we have to wait for the hormones to get back to normalcy, and only then we would like to touch the patient to make sure that future you do not end up with other skin issues, or you do not develop some other problem because of the treatments given initially during this phase.
Okay. So the ideal period would be to wait for 4 to 6 months.
Yes. But you can take a routine skincare and not do other major procedures. But yes, you can use some other creams or some face packs or some specific washes, or use whatever. There are many things in the market, or many things which we can also prescribe or advise to be used when there is a skin problem. So it's not that you don't do anything for the 6 months. Yes, you can do quite a lot of things, but not the first choices wouldn't be laser or peels.
Okay, sure. So thank you so much. So all moms, you need to wait for 4 to 6 months. That brings us to our third giveaway. That is, so moms, now you have to share your skincare routine or your skincare products that help you bounce back during your postpartum phase. So moving on to do drop in your answers in the comment section. And moving on to our next query for ma'am. how can new mothers incorporate good skincare treatment? We just spoke about, you can do your regular routine things. So what are the do's and don'ts with respect to skincare for a new mother?
Well, first and foremost of all, keep it very, very basic. Post delivery, make sure you're having your baths regularly, which again becomes a problem with the baby. And then you develop a lot of folds in your body, which is not normal. You have developed, you have become fat in certain areas. The body contouring has changed drastically. This is just physiological, and it will all come back to normal once you exercise and take care of yourself. But during the initial phase, making sure that everything is kept clean and the skin is kept dry so that you're not, especially in India, what we say is they develop a lot of fungal infections. It's not that they're not clean, it's just that you sweat a lot, or sometimes, there's a lot of milk flowing and it has, kept some areas very, very moist. And because of that, you develop such problems. So using some kind of a drying agent, like even dusting yourself with some powders which will avoid you to accumulate all this moisture, or using some kind of moisturizer if your skin is dry or if you're having irritable skin, and making use of mild cleansers if you have dry skin, because usually the skin is quite sensitive, so mild cleansers would really help. No, don't scrub your skin too much, at least for the first few weeks after your delivery. Don't use any scrubs at all, would be ideal. After that, you can of course try some face packs, try some hair masks, whatever you like, but these are all not going to bother you. But overdoing anything would really get you into trouble. So keep it simple.
Okay. So thank you so much, ma'am. So the general feedback is keep it simple. Use your daily, daily routine. Having a daily bath, yes, it does make a lot of change. We have got a few answers from the viewers. Raksha says aloe vera gel and coconut oil, bathing with warm water, traditional remedy. Kalyani also says coconut oil helped me a lot. Bandana says I drank a lot of water, took iron and calcium supplements. Most important, took help from in-laws for managing the baby. Then we have Megha, who says better nutrition, proteins, calcium supplements, regular moisturize to skin, regular hair massage with oil, and most importantly, better sleep and less stress. So wow, that's an absolute perfect answer, I would say. And the winner for this giveaway is none other than Megha. So congratulations, Megha. Do drop in a message on our Instagram handle so that we can get back to you with the details for your giveaway. So moving forward to our next question, ma'am. Are there any particular precautions that new mothers need to take when they are using particular skin products while breastfeeding? And what are the ingredients that they specifically need to avoid so that it doesn't cause any damage to mother and the baby?
As I already said, retinoids is absolute no-no, and corticosteroid ointments also. Many a times when people see these rashes, they over the counter they buy steroid creams and apply it. It's absolutely not allowed. Please don't use it at all. So make sure you're meeting a doctor, finding out what your problem is, and then treating yourself accordingly what is necessary. Sometimes people pop in some pills like antihistamines also, saying that I always took them. But yeah, during pregnancy and during after delivery, it's not allowed, because if you're breastfeeding, then the medications which you're using, be it antibiotic, be it antihistamine, or any kind of medicine which you're going to take, is going to be secreted in the breast milk, and it will go to the baby also. So you have to keep in mind before you take any medications.
Okay.
And topical applications, don't believe that it's just applied on the skin so it doesn't get absorbed. All the applications which you apply on the skin gets absorbed, and it goes to the skin in the mainstream, that is the bloodstream, and it goes to the baby also. Yes, the proportion can be much, much lesser. If it's taken orally, it's more, and then if you're applying topically, it's lesser. But why do you want to do it? Is it absolutely mandatory that you want to do it? Then you have to weigh the pros and cons and then decide if you need to do it or not.
Hello. Yeah. Ma'am, we have a couple of questions from the audience as well. We'll just take those in. We have one from Krishika who says, my baby got tiny rashes from day one and gynec suggested calamine lotion. Once I stop that, he gets it again. How long to use?
Well, many babies develop something called neonatal acne. That is because of the hormones from the mother which is transmitted to the baby. So ideally, you should they go away themselves, you know. So you don't have to do much. And if you have used calamine lotion, how long have you used it? And did you consult any dermatologist? Because rashes can be of different types. There are some congenital skin problems which babies come up with as soon as they're born. So those kind of things have to be ruled out if it is some other problem, because since she says it comes back, then we have to think about it. Otherwise, usually do nothing, leave the baby alone, and it will go away once the hormones in the baby is also excreted away from the system.
Okay. So I hope this answer was helpful to you. Ma'am, we have one more question. That is, please tell us more about Cureka.
Cureka is a digital platform which we introduced to have products or selling products online. These have healthcare products, wellness products, baby products. It's just food for anybody who wants to or wishes to live a good lifestyle, a good healthy life. Then Cureka is there to help you, because we have a lot of doctors who curate these products. So if they have any doubts, that can be clarified. If they want to ask a doctor what to use, so many a times, you know, the people are asking, like, can I use this medication with this shampoo, with this cream? And then we would ask them to send a picture or something and find out what would best suit them, and accordingly give them the medications. So this is just a platform we have created so that everybody lives a healthy life. It's for everyone to live a healthy life.
Okay, so thank you so much, ma'am, doing so much for all the citizens. And now we move on to our main bumper giveaway. And the last question for bumper giveaway is, what impact do you think that diet and lifestyle have on improving postpartum skin health? So this is a question for all our viewers. I'll just repeat it once again because it's a bumper giveaway. I'm looking for more participation this time. What impact do you think diet and lifestyle have on improving your postpartum skin health? Ma'am, and one more question for you, the last question, mostly from our side. What is the best way for new mothers to approach a dermatologist for postpartum skin concerns? Like, what should they expect from your first appointment?
Well, you can go directly to the doctor, or you can have a digital consultation also online. When you're having a digital consultation, suggestively take photographs of the areas which is bothering you. So if you have a clear-cut photograph, like a close-up photograph of the skin problem you have, then the diagnosis and assessing the skin becomes a little bit easier. So you send it across, and you can have a digital consultation also. Because with the baby, it might be difficult for you to go and meet a doctor personally, so you can do that. If your problem is much more and you really have some other issues which is bothering you too much, then go to the dermatologist directly. And of course, they will help you out a lot, and they will make a diagnosis. That is more important, because without a diagnosis, just imagining it could be this and asking for other people for advice, and they would say, yeah, those days we had it like this, we had it like that. So many things are missed out also. So suggestively, go directly to a dermatologist if you're very worried and you really have a problem. But I suggest usually don't go to everybody else and ask for suggestions. Go to a dermatologist so you are on right track and you expect them to give you the right medications, the right treatment, and the right suggestions of how to go forward with the problem.
Okay. So thank you so much, ma'am. We have one more query from our audience. Krishika says her sister is pregnant and she doesn't like smell. Her skin is dry and not liking the smell of aloe vera cream. Can she use coconut oil instead?
Yeah, she can. Coconut oil is fine. And let her use some mild cleanser also, because when you use soaps, it strips off the normal oil in your skin also and makes it much more drier. So how much ever you try to moisturize, it might be bothering you. And you can use some moisturizers which contain oats and all if you do not like aloe vera. Generally, if you have to use pure aloe vera, it has no fragrance. So pure aloe vera shouldn't have any fragrance. So you can change the brand or the variety or the source of the aloe vera and try that also. There's no harm.
Okay. Ma'am, there's one more query that even we had. What exactly is the relation between skin care and mental health? A good skin care care and mental health?
We always connect skin health to mental health because there are a lot of skin problems which bothers the people a lot. Because the first thing, I very proudly say it's the largest organ in the body. So if you have a liver problem or you have a heart problem, it doesn't show. Somebody who's going to look at you and he's not going to say, oh, you got a problem in your heart, I can see it. No. But if you have a problem in your skin, everybody sees it and everybody looks at it, and sometimes some people sympathize, some people are like, what? Why did you get that? And then in India, the very best thing everybody wants to do is give you free advice. They're so concerned about it. And so then the list of advice which they give you, that try this oil, try that cream, my relative was like that, my this thing, try it like this. And then by the time you come back home, you're so confused and you're so disturbed. And then you're looking at the mirror and trying to see what the hell is actually wrong with me that everybody had to advise me this. So, you have to, it directly relates to mental health, and we always tell whenever a patient comes and then they tell that they have a problem. So the problem is from their perspective instead of it being from our perspective. So if there are some people, like I had once a patient who had had her face filled with pimples, and then she walked in and I was waiting for her to tell me what her problem. Then she said, you know what, I have a scar on my leg. And I was like, what? So, sometimes these pimples don't bother them at all, and it's their attitude which matters more than anything else. So mental health is directly proportionate to skin health.
Yeah, that's absolutely true, because someone who has been, facing uneven skin tone for larger part of my life, I can very well relate to the same. Ma'am, we have one more query. Hello, doctor. I'm suffering from panic attack after my second delivery. Please suggest.
These are very common things. What happens is, see, childbirth and having a post-delivery, the stress on there is a lot. If there is less family help and things like that, then the stress is quite a lot. What happens is, there is first child who again becomes very demanding because the child has got its insecurities in themselves. You can't blame them either. And then the mother who has too many hats to wear and too many things to do, and physically it's very tiring, and it's very overwhelming when such things are all come together. So panic attacks are common. You will need help. You should go to somebody who's going to counsel you, who's going to help you, and seek advice and seek help. Don't accept it and just sit quiet and say, this has happened. And then if you're feeling negative, speak up, please. You have to get over this over a short period of time as fast as possible. And you have to accept that these two are your children, and you have to enjoy pregnancy and childbirth and rearing children. That should be your attitude, not getting overwhelmed or scared about it. Then you need help. Please go and seek help.
Sure. Thanks so much, ma'am. So we just move on to the next. I don't know whether there's an echo. Hello.
I can hear you quite well.
Yeah. So the input that we got is from Vandana. We've got 3 to 4. Yeah. 3 to 4 answers for the query that we had on postpartum and impact of lifestyle. Diet and lifestyle definitely have a huge impact on postpartum skin health, as our body has literally come from a major stage, and it needs extra care, pampering, and correct diet and care. Megha says it will have a huge impact on maintaining skin health. It will help get back to our previous hair quality, reduce acne, reduce hormonal changes, get over stretch marks, and most importantly, stay confident. Bandana again says corrective diet. Yeah, proper diet, sufficient hair. Nutritious diet only for mother. So basically we've got a lot of answers that is Vandana and Megha. So the winner of a bumper giveaway is Vandana. So congratulations, Vandana. Please get in touch with House of Zelina. Yeah, I know my voice is echoing, but I don't have another device right now. So I just have a laptop with me. Hello?
I can hear you.
It's still echoing.
Yeah, it's fine if it's echoing. It's just a little bit, so it's fine.
Hello? Still echoing from my side. Okay, so moving on to our next question, that is any personal hygiene advice to take care for mom and baby?
If you have had a normal delivery, then what happens is the episiotomy wound, that is the wound which is in the vaginal area, needs to be taken care of well. So you can use antibiotic ointments, creams or something like that, and make sure that area is kept very clean. And you can use, intimate washes to make sure that your area is kept clean. And then post-delivery also, the bleeding is also quite a bit in quite a few people. So during those time also making sure that your personal hygiene is maintained well, that changing your sanitary pad regularly, and making sure that you are cleaning each time you change your pads. All that, if it's taken care of, then you shouldn't worry much. So the personal hygiene, I'm talking only about those aspects. The rest of it, of course, everybody knows, I guess. If there's something specific you want to ask me, yes, please go ahead and shoot your question.
There is no specific. Yeah, we have got another specific question. Got grey hair while breastfeeding. She is 28 years old. Her kid is a preschooler, and is it possible to stop grey hair?
You have to increase your multivitamins and make sure you're making your dietary changes. And usually we advise patients who come with a in today's diet, it's not, it doesn't, usually Indian diets or genetically we are coded to have more fresh fruits and more vegetables in our diet, which is not happening off late. So what happens is this dietary changes of having processed food or more processed food in your diet does lead to gray hair, and of course the stress. So the stress is not only like mental stress as such, we call it oxidative stress, which takes place at the level of the cellular level at the hair bulb, and this causes this. So what you could do is a good dietary change, adding a lot of antioxidants in your diet, and having a lot of fresh fruits, healthy food in your diet, like sprouted beans. It could be green leafy vegetables, carrots, beetroots, fruit juices, or a lot of fruits also. All that can help a lot. And apart from this, yes, you can use some sprays which are available in the market, which can help regrow the hair black in color, or you can use some multivitamins, which also helps to revert graying of hair.
Okay, sure. So I hope that satisfied your query. We have one last question now. What about red mark on newborn? Is it related to the red rashes on a newborn?
Red rashes on your body?
Yeah.
Yeah, it can. And sometimes what happens is you develop some red rashes during your pregnancy also. There are several conditions and several names for this. And if you have developed it during your pregnancy, and you might need some topical applications, but a dermatologist should prescribe it. And post pregnancy, it goes away also. So you can, you can wait for it to go away if it's very mild, or if it's bothering you, then you should meet a dermatologist and take treatment from them. And if it's there post delivery also, you might need some help from a dermatologist. You might need something to be done about it. This red rash which you're talking about is a very, very wide subject according from my perspective. So I can think of at least 10 conditions which I can enlist immediately and say, okay, probably it's this, probably it's that. And for everything, the treatment will vary. So my answer is quite vague and weird, I guess. But if you could be specific or ask me something, then I can maybe help you out.
He's saying on newborn.
Newborns, okay.
Yeah.
Newborns, red rashes shouldn't be there actually. If it's there, sometimes it's stop bite. They have it around this part of their face or on their forehead. Then what? Because of the passage through the delivery canal, and being there for some time more than necessary, it does happen in some children. But if the rash is there for quite some time or it's not disappearing or not going away, then you have to see, because sometimes what happens is some nevus also presents like that, especially if it's on the face, then we have to think twice. Because if it is a nevus, then we have to figure out if it's just there on the skin or it's there something internally also. Usually what we try to check is for a very simple calculation, if you have to see a red patch on somebody's face, so if the patch in the child is there inside the eye, then it indicates there's something inside the brain also, and that needs to be checked real fast. Otherwise, you can wait for some time and watch the baby or show them to a dermatologist immediately and find out that the baby is absolutely fine and everything is fine with the child. That's all. So that's where you have to worry about red rashes, because some red rashes sends weird signals across saying that there is something inside which is representing on the face or on the skin superficially.
Okay, sure. So thank you so much, Dr. Hema, for sharing your valuable time. We hope that our viewers had an amazing session today. And your session was very informative. Yes, there is an online way. You can visit Second Opinion, Cureka, and all the lectures were done. So thank you so much on behalf of House of Delega for this wonderful session. I'm sorry because of the echo. Talk.
No, it's fine. I'm sure you were great. Thanks.
Sure. Thank you so much.
I really enjoyed all the questions and answering the audience. I hope it was beneficial. I know usually, when we have sessions in skincare, the questions goes on and on and on and on, and 1 hour goes to 2 hours, and then it's still on. So if you have any queries, you can send it across to our Cureka team, and I'd be happy to answer them at any given point of time.
Sure. So thank you so much. And to our audience, we have pinned a comment right below this chat, and you can have a look for the wonderful discount that Cureka is providing exclusively for House of Zelina members. So thank you so much for to ma'am and the audience for sparing Saturday afternoon. Thank you so much. Bye.
Thank you.
Bye.
Bye-bye.